Welcome to Rise Unwind. Every week on our show, we bring you lifestyle tips, tricks, and more from all the people who know it best. And this week, we have this.
The characters that I do or the voices I do or stories I do come directly from my environment or people around me or how I grew up and stuff like that. So yeah, my character Creeper, who does Cholo Fit, that came straight from my dad. He was in a lowrider car club, all that good stuff. So yeah, that's just an example of just boom. I just draw from right what's right next to me, and nothing's off limits. And my family has learned to be okay with that.
The cycle of surgery, knowing you're only going to have another surgery, it takes a toll.
So it's not just a relationship issue. It's not just a health issue. It's actually a productivity and economic and workplace issue.
So when it comes to cost, step back and review your healthcare expenses from the prior year. Think about your budget. Think about your health needs in the coming year. Consider premiums, deductibles, and out-of-pocket maximums when determining what is the right plan for you.
All that and more on Rise and Unwind. For people living with recurrent respiratory papillomatosis, or RRPs, surgeries have been the only way to manage it, sometimes dozens or even hundreds over a lifetime. Now there's a new non-surgical treatment that's offering real hope for the first time. Joining us are Dr. Simon Best from Johns Hopkins School of Medicine and Michael States, a patient who took part in the clinical trial. Welcome to both of you.
Thank you.
Thank you.
And Dr. Best, what is RRP and how does it affect people who are living with it?
Well, thank you. And we're really excited to be here on behalf of Precigen to discuss recurrent respiratory papillomatosis, or RRP. RRP is a chronic viral infection caused by the HPV virus, type 6 or 11. Affects the vocal cords. And so it leads to voice changes and breathing difficulties as these papillomas grow on the vocal cords. Historically, the only way to treat this was with surgery. So patients would go to the operating room. We would use lasers or other instruments to remove the papilloma. But because we haven't addressed the underlying infection, the papilloma would recur. And so patients are in an endless cycle of surgery, recurrence, that affects their voice and breathing.
Michael, can you share what life has been like living with RRP and how it's impacted you personally?
Through my journey with RRP, I've had over 50 surgeries. I lost count, but I know it's over 50. The cycle of, like Dr. Best mentioned, the cycle of surgery, knowing you're only going to have another surgery, it takes a toll. At one point, or as the disease progressed, my voice just disappeared. I was down to a whisper. That affected me professionally. I'm a dentist by trade, and I was having a very difficult time communicating with patients. But it also took a personal toll. I started avoiding social situations because I couldn't project loud enough, carry on conversations with family, friends, colleagues, and which made me uncomfortable, and they were uncomfortable too because they couldn't hear me. It would ask me to repeat myself. Eventually, I just became a social hermit.
Dr. Best, how does this new treatment work compared to the repeated surgeries patients have had to go through for years?
Well, Papillomatosis is a approved treatment now for adults with RRP. It's an immunotherapy. It's designed to boost the immune system, direct the immune system to actually seek out and identify cells that have the HPV virus, and then using your own body and your own immune system to eliminate those cells. So it's breaking the cycle of repeated surgeries by attacking the HPV virus really at the source.
Michael, what has it meant to you to participate in this clinical trial and to see this treatment approved?
I don't know that I can even put it into words, but with the treatment with Papillomatosis, the minor side effects that I experienced were very similar to having a flu shot, having a COVID shot. Compare that to the repetitive ongoing surgeries. Plus, I have my voice back. I had my last surgery April 2022. I went into the trial in July of 2022, and I haven't had surgery since. I'm also very proud that I was able to contribute in my own way to the science behind this so that for the thousands of people with RRP, they now have hope beyond just surgery.
And finally, where can our viewers go to learn more about RRP and this new therapy?
There's a lot of new information about RRP and about Pabzimios at the Precigen website, which is precigen.com.
Dr. Bess, Michael, thanks so much for being on the show.
Thank you.
Thank you for having us.
Many women start noticing changes in their 30s or 40s, things like fatigue, mood swings, or brain fog, but might not realize it could be the start of perimenopause. It's a stage that affects women in so many ways, physically, mentally, and even professionally, but it's something that often isn't talked about enough. Joining us today to help shed some light on this important topic is Dr. Samina Rahman, a board-certified OBGYN who specializes in midlife women's health. Welcome to the show, Doctor.
Thank you so much for having me.
Dr. Rahman, can you start by explaining what perimenopause actually is and when most women start to notice changes?
Sure. Perimenopause is that transitional period of time that's leading up to the last menstrual period, that final period that's known as menopause, and the time after that is postmenopause. So that period of time leading up to your final menstrual can be anywhere from months to a decade. And so for some women, that means that if their last menstrual is in their 40s, they might actually start experiencing symptoms in their mid to late 30s. And these symptoms can be vast because it's really due to the fact that estrogen is fluctuating like crazy in your system. And so some women will have, like you described, the hot flashes and night sweats, while others are struggling with word finding, cognition, muscle pain. They might have genital urinary symptoms. There's so much that happens that needs to be addressed.
I can definitely relate. How can symptoms like fatigue or brain fog impact daily life, especially for women balancing work and family?
Yeah, I think it has a tremendous impact. I hear it every day. People don't feel like themselves. They're struggling to, be productive. A lot of women, have impact on their relationships because of, how they're feeling mood-wise or sleep-wise. So some relationships are disrupted. You're balancing a lot. There's a lot of stress happening. Flow actually has done some research on this as well. And what they found was that there was at least a $2,700 loss in productivity per women that were studied, and this accounts or equals about $22 billion loss in productivity nationally. So it's not just a relationship issue, it's not just a health issue, it's actually a productivity and economic and workplace issue.
And what are some practical things women can do to help manage or ease these symptoms?
Yeah, I always say the first step is really educating, so that you can advocate for yourself, getting aware of your symptoms. And sometimes it's hard to know how to get aware of your symptoms. And that's why Flow this summer launched a perimenopause mode, which is essentially like their educational platform for what perimenopause is, all the different symptoms you can have. They also have a perimenopause risk assessment scale or score that you can obtain to tell you the severity. So like if someone comes in and tells me their information based on what they've recorded in the Flow app, for instance, then I can help navigate their treatment better. I can help them with the lifestyle modifications that they need, sleep, stress, eating, and movement. We can help them consider whether or not hormones are a possibility, and also things like other medications. So education, awareness is always the first step.
Why do you think it's so important for women to have honest conversations with their doctors when these changes begin?
I think this is a key time for women to really make time for their own health. And so if they can have these honest conversations with their doctor and have a better assessment of what their body is experiencing, then they can get actually better treatment in terms of knowing what's the best treatment and the best method for them to navigate this time in life. So it's really important for us to be able to be open and upfront with our clinicians or whoever's taking care of us so that we can better navigate our experience with them, because it's all about shared decision making and really being really precise on how we treat our patients.
And finally, for anyone who wants to learn more or find additional support, where can they go for more information?
Yeah, just head on over to flow.health, or you can actually download the Flow app. And this will be important for you to get some education. You can get the perimenopause risk score. That assessment is actually available free to over the age of 35 during the month of Menopause Awareness Month, which is October. And then we can also, you can also build some community over there because there's so much community involved in the Flow app that you won't feel alone in this transition.
Really helpful information today. Dr. Rahman, it's been awesome having you on the show.
Thank you so much for having me.
Health coverage can be confusing, especially for anyone new to Medicare. But this time of year is actually the perfect time to look at your options. Joining me today is Jeremy Gaskill, Regional Medical President with Humana, here to explain the annual enrollment period means and how Medicare Advantage plans can help people stay healthy and covered. Welcome to the show, Jeremy.
Thank you for having me.
Great to have you. Why is right now such an important time for people who are eligible for Medicare?
Well, as you mentioned, the annual enrollment period is occurring right now. It began on October 15th and it ends on December 7th. And this is the time of year when beneficiaries can review their plan, they can make changes to it, they can enroll in Medicare Advantage plans, as well as prescription drug plans. And all of this takes effect January 1st of 2026.
You mentioned Medicare Advantage and Medicare. What is the main difference between them?
Yeah, that's a great question. Original Medicare is a federally managed health plan. Now, this covers your hospital stays and your doctor visits, but there is a deductible associated with this. And essentially, members are responsible for about 20% of the total cost. It's important to point out that if you want a prescription drug plan, this must be purchased separately from Original Medicare. Now, Medicare Advantage plans are administered by private insurers like Humana. So in addition to coverage for your hospital stays, your emergency room visits, your doctor visits, there can be coverage for additional benefits. Just depends on where you live. One of the most important things about Medicare Advantage is that there's an out-of-pocket maximum. So you know what it is the most that you could spend in a given year.
Jeremy, when choosing a Medicare Advantage plan, what should people keep in mind?
Yeah, I would say cost and then coverage. So we encourage everyone to take a moment, step back, review their current plan, and make sure they understand if there's any changes being made to it in the coming year, because there can be changes year over year. So when it comes to cost, step back and review your healthcare expenses from the prior year. Think about your budget. Think about your health needs in the coming year. Consider premiums, deductibles, and out-of-pocket maximums when determining what is the right plan for you. And when it comes to coverage, remember, Medicare Advantage plans have networks. So ensure that your doctor and your preferred hospital are in network. And if you're looking at a Medicare Advantage plan with prescription drug coverage, make a list of your medications, ensure they're covered, and make sure you understand if there's any additional cost associated with any of these medications.
How do these plans help support things like preventative care and regular doctor visits?
Yeah, I would suggest that Medicare Advantage plans emphasize preventive care and care coordination. Many of these plans will cover your annual routine physicals, your annual routine screenings, your management of chronic conditions. And all of this is to ensure that you stay healthy and that there's early detection, which just ultimately leads to better outcomes. So when you're comparing plans, look at how is preventive care covered? What screenings are covered? And is there any additional cost for any of this?
For anyone who needs help comparing plans or signing up, where can they go for support?
Yeah, Medicare.gov is a great starting place. They have a really neat tool where you can compare plans side by side. There's also a number of professional licensed sales agents that you can engage. They can sit down with you and help you pick the right plan for you. And if you're interested in specifics about Humana, Humana.com is a great place to go.
Thank you for all the information, Jeremy. It's been awesome to have you on the show.
My pleasure.
When someone is diagnosed with prostate cancer, it often takes a team, and that includes the caregivers who provide daily support. New research highlights how essential those caregivers are, from encouraging early screening to helping manage treatment. Here to talk about it are Dr. Daniel George from Duke University and Gina Carithers, President and CEO of the Prostate Cancer Foundation. Thank you both for being here.
Thanks for having me.
Thank you.
Dr. George, can you tell us a little bit about prostate cancer and which men are most likely to be affected?
Sure, Amanda. You know, the truth is that all men are at risk for developing prostate cancer as they age, but there's certain subgroups that are at greater risk. So in particular, men with a family history, a father or brother, you're at higher risk of developing prostate cancer. If you identify as Black or African ancestry, you're at greater risk of developing prostate cancer. And we recommend a PSA, it's a simple blood test, to be drawn by your primary care doctor somewhere between age 45 and 50. And if that level is above 1.6, you're at greater risk of developing prostate cancer. So these are the three groups that we especially focus on, but really all men should be screened.
Gina, what are some meaningful ways caregivers can help their loved ones during treatment?
Sure. So for a patient that's been diagnosed with prostate cancer, the loved one, the caregiver, can provide support by staying and getting educated themselves, right, on the disease process and various treatments. They can be the one who goes with the patient to the physician appointments or other healthcare provider appointments as they're needed. And they can help share the journey by offering, their ears and their knowledge through to shared decision-making with the patient about what are the best treatment choices for them, and then how, in fact, you can support the patient for nutrition and exercise and all the things that go around the care of that individual.
Dr. George, how has prostate cancer treatment changed in recent years?
Amanda, it's changed a lot. And I think, the public may not be aware all the advances we're making in this disease. There's new diagnostics for localized disease to help us really fine-tune the treatments for the patients and not overtreat people. For men who have disease that's spread outside their prostate to other organ sites like bone, we call that metastatic prostate cancer. Historically, that they had a survival of 2 to 3 years. Now it's closer to 7 to 10 years, and who knows what we'll have for therapies at that point. So this is now a long journey, even for our patients with the latest stages of disease, and all the more reason these patients are surviving a long time to really invest in their health care for this. We have a new website to help explain all of these combination treatments and what might be right for you. It's called advancedpctreatment.com, and I'd encourage your listeners and viewers to come out and check that website out.
Gina, what types of support are available for both patients and caregivers?
Sure. So there are numerous resources available. At the Prostate Cancer Foundation, our website, pcf.org, we have a tremendous amount of background information on the disease itself, the biology of this disease, and how this disease can be treated. In addition, we have information on the value of nutrition and exercise and participating in community activities with your loved ones and your family. And then, of course, there is the advancedpctreatment.com website, which provides a tremendous amount of information for those with advanced prostate cancer to help guide them on their treatment journey.
And Dr. George, I want to say one more time, just where can our viewers go if they'd like more information or resources?
Yeah, Amanda, I really recommend this website, Advanced PC for Prostate Cancer Treatment. That's all one word, advancedpctreatment.com. It's really written for patients about advanced prostate cancer, that stage of disease that 10% of our men are presenting with. And it's a great way to get empowered and educated around your options.
Dr. George, Gina, it's been awesome to have you on the show. Thank you for being here.
Our pleasure. Thank you.
Thank you.
If your Thanksgiving to-do list already feels a mile long, you're not alone. But this year, there's an easier way to shop, prep, and still enjoy your day. Amazon spokesperson Griffin Buck joins us with some simple ways to make Thanksgivings delicious and stress-free. Welcome to the show, Griffin.
Thank you so much for having me, Mandy. It's great to be here. Yeah, that's right. Thanksgiving and the busy holiday season are right around the corner. And at Amazon, we're here to make meal prep both affordable and convenient for everyone.
Awesome, Griffin. A lot of people are watching their budgets this year. How can we keep Thanksgiving affordable?
Customers can feed 5 for just $25 when they shop Amazon's Thanksgiving meal deal from November 12th through November 27th. It's one of the best deals around. The meal includes all the essentials like a butterball turkey for just 69 cents per pound, pre-made sides like home-style stuffing and mashed potatoes, and traditional fixings like gravy, green bean casserole, cranberry relish, crescent rolls, as you mentioned, and of course, a holiday pie to wrap it all up. And we know that many folks will be traveling for the holidays, which is why the savings go beyond the kitchen. Every Friday through the end of the year, Prime members save 25 cents per gallon when they fuel up at participating BP, Amoco, and AMPM locations nationwide. That's more than double the everyday Prime fuel savings, just as millions get ready to hit the road for the busy Thanksgiving travel season.
And what are some simple ways to make meal prep faster and easier?
Yeah, if you're trying to make meal prep faster and easier, you should shop strategically. Take advantage of pre-made sides that deliver convenience and value without sacrificing quality. Items like the home-style stuffing or mashed potatoes or even macaroni and cheese that don't require multiple cooking appliances or lots of extra time in the kitchen will allow you to save time and spend it with your family and on the main courses. But if you prefer to make your own items from scratch, or maybe you've got a family recipe that's been handed down for generations, we've got great deals on a variety of grocery items as well, like gold potatoes, whole carrots, or even cut green beans.
Griffin, how can we make sure our Thanksgiving day goes smoothly from start to finish?
Yeah, to have a smooth Thanksgiving day and keep the stress levels low and the kitchen and the oven free, it's great to start with no-cook appetizers. You can make a delicious appetizer spread that requires absolutely zero cooking, like this charcuterie board right here, made with premium meats, cheeses, crackers. We've got some store-bought dips, and the whole board is elevated with some nice fresh herbs. It'll keep your guests, the hunger will stay away. They can have a couple snacks while you're focused on the main items and cooking up that dinner, exactly. Another thing you want to remember is don't forget about the dessert. Not that anyone would forget dessert, right? There are so many different flavors, and it's hard to choose just one, which is why we have a variety of pies available for less than $7, including pumpkin, pecan, sweet potato, apple, berry, and cherry pie. And if you want to take your dessert table up a notch, why not add some additional toppings that your guests can sprinkle over on top? Ice cream, whipped cream, those are essentials. We always have to have those, right? But maybe some hazelnut spread on your pumpkin pie. Or maybe my personal favorite is salted caramel drizzled on top of my apple pie. It's a great way to get everyone excited about dessert.
That is not a bad idea at all. Griffin, this happens to me all the time. If we forget an ingredient or two, what's the best way to grab what we need without the holiday chaos?
Yeah, get ahead of the holiday rush. The holidays are about spending time with the people you love and not stressing about last-minute shopping. There's nothing more convenient than getting your groceries delivered straight to your door. And you can do that with same-day delivery of perishable items through Amazon.com, Amazon Fresh, or Whole Foods Market. It's also important to remember to delegate and share. There's no need to do every single thing yourself. Ask your guests to maybe bring their favorite appetizer, a side dish, or a dessert. That way they can feel like an important part of the meal, you can focus on the essentials like the turkey, and finally enjoy your own party.
Griffin, where can viewers go to start planning their Thanksgiving feast the easy way?
Customers can go to Amazon.com/grocery to start exploring our selection of holiday favorites and everyday low prices on grocery essentials. We're here to make holidays stress-free and easy so you can enjoy more time with your family.
Such helpful information, Griffin. Thanks for being on the show.
Thanks so much for having me.
Have you ever had one of those family cookouts where everyone's talking a little too loud and the cheese is flying faster than carne asada hitting the grill? Well, comedian Frankie Quiñones knows that feeling a little bit too well, and he's turning that into comedy gold with his brand new Hulu special, Damn, That's Crazy. Directed by Emmy winner Ali Long. Frankie is here. Welcome to the show. You might know him from This Fool, What Do We Do in the Shadows, and Victor and Valentino. He's bringing the mix of heart, hilarity, and familia to the stage. Welcome to the show, Frankie. How are you, my friend?
Oh, good. Dan, thanks for having me, homie. I appreciate it.
No worries, man. All right, this is your first hour-long special. Okay, what made Damn That's Crazy the right moment to put your life and your comedy pretty much out there on the stage?
Yeah, man. Damn, that's crazy. We say that a lot growing up around the home, around the homies and stuff. Damn, that's crazy. But yeah, just some of the topics I touch on. I met Ali Wong a long time ago, and she obviously her career took off, multiple Emmys and stuff like that. And then we were doing some tour dates together, and she goes, "Hey, I want to produce and direct your special." And I was like, "I'd be honored." And then the timing just kind of worked out perfectly with Hulu launching this slate of comedy specials. And then we got into talks, and then, here we are. We took over a year to get the material down. And then, we recorded the special with the help of Ali Wong. We pieced together a pretty cool piece of work that I'm really proud of. So I'm excited for people to see it. So that's what's up. And damn, that's crazy.
And this special, it dives into love, addiction, and the politics of family carne asada. How much does that come straight from your own family gatherings, my friend?
Oh, yeah. I draw a lot from family. But yeah, we've been through a lot together, ups and downs, and I kind of touch on all of that, get vulnerable about a lot of stuff. And also, yeah, a lot of people can relate to any family event. In my case, it's the carne asada, which is like our barbecue, and the drama that comes with that. The tias, the aunties talking smack about each other, spreading rumors like, oh, your tia Rosa is a potato salad, doesn't have any flavor. I think she's going through something, and it's like, no, she's not. The potato salad is fine, but they always trying to just stir something up. That's just an example. It's just like the drama that ensues at a family barbecue or carne asada.
Oh yeah, I have the same aunt. I have the same stories. I grew up the same way, my friends. You played some unforgettable characters from Luis and This Fool to your sketches in Get Frankie. How do you decide what parts of like real life make it into your comedy?
Yeah, I mean, nothing's off limits to me. Especially when it comes to family stuff or stuff like that, because it's something that a lot of people can relate to, no matter what background you're from. But yeah, I would say, the characters that I do, or the voices I do, or stories I do, come directly from my environment or people around me or how I grew up and stuff like that. So yeah, my character Creeper, who does Cholo Fit, that came straight from my dad. He was in a lowrider car club, all that good stuff. So yeah, that's just an example of just boom. I just draw from what's right next to me, and nothing's off limits. And my family has learned to be okay with that.
And Ali Wong directed this special. What was it like collaborating with her and bringing that energy to the stage?
Yeah, you know what? It really was an honor, because obviously I've known her. We met in a laundromat / cafe where they do an open mic, because there's like a built-in audience, people waiting for their laundry. But yeah, it was so cool to see her career just take off. And then when we started working on it, I didn't know how hands-on she was going to be, and she was really hands-on. She was a huge help. She has such a great eye for things, because people are like, well, what does it mean to direct a comedy special? Yeah, most of it is just the camera setups, but it's what goes on behind the scenes before and after the taping. And she was really hands-on to help me in the editing, and then picking what frames go on what punchline, down to the details like that. And I think it really helped in the end create this super polished piece of work that is now called Damn That's Crazy. Yeah, so yeah, it was fun, man. It's really fun to work with her and watch her work and see her talents in that avenue of being a producer. Yeah, it was cool.
And you've been doing a little bit of everything, acting, stand-up, voice work. After the special, what's next for you? Any new projects you could tease and let our audience know? I won't tell anybody. Nobody actually watches the show, so anything. No NDAs here, my friend.
No, you're all good, man. Yeah, I'm on the next the season coming up of St. Denis Medical. It premieres in November, and then I got a YouTube show called Creeper's Crib, live from my grandpa's garage. That's the first episode just came out of that, and then I got a movie coming out next year with Tom Segura and Luke Wilson, Tim Baltz, Genesis Rodriguez, called El Tigre. So be on the lookout for that, and hopefully I'll be on tour in your city soon. And hope to see you there. Let's kick it.
Of course, I'll be there. You can catch Frankie Quiñones. Damn, That's Crazy. It's now streaming on Hulu. For more on Frankie's comedy projects or tour dates, visit frankiequiones.com or shop his Cholo Fit collection. It's available on his website, my friend. Orale! Frankie, thanks for joining me.
Thank you, Dad. Appreciate it.
Thanks for watching Rise Unwind. Please visit us on our website at riseunwindtv.com. Follow us on our socials and subscribe to our YouTube at Rise Unwind. And thanks for tuning in. You take care, and we'll see you next week.